Hi everyone, I'm Dr. Fairuz, an orbit and oculoplastic surgeon. I'm here today to talk to you regarding a serious illness, a serious disease which has been emerging rapidly during the past few weeks associated with COVID-19 infection, the fungal infection Mucormycosis. Yes, the black fungus. It is dangerous, it is serious, and it can be life-threatening as well. So why is it called a black fungus? Is the fungus black? No, the fungus is not black. Then why is it called a black fungus? It is because the fungus affects the vessels and it's called angioinvasion. Once it affects the vessels, it blocks the vessel, and once the vessel is blocked, there is no blood supply to the tissues around the affected places, and then it undergoes necrosis and the tissue dies, and once the tissue dies, it becomes black. It can be inside the nose, it can be in and around the nose, over the face and around the face. So this is how it appears. Whenever a tissue is affected with mucormycosis, it turns black, and that is why it's called black fungus. Now, how do you get infected with this? So mucormycosis, there are different types. And as an ophthalmologist, on an eye perspective, the one type that we are seeing now is the rhino-orbitocerebral mucormycosis. Rhino means the nose, through which it enters, then it reaches the sinuses, and then the eyes and the orbit, that is orbito, and cerebral. And then finally, it extends into the brain, making it life-threatening. So this is how we have been seeing patients presenting with recently. You have to be cautious about the symptoms. You have to be aware of the symptoms regarding rhino-orbital cerebral mucormycosis. I have been receiving a lot of calls and panic visits from patients regarding mucormycosis. It's very important to be cautious about it, cautious about the symptoms. So what are the symptoms of rhino-orbitocerebral mucormycosis? As it enters the nose and the sinuses, initially to start with, the patient might have a one-sided headache. And then they can also present with dryness in the nose, discomfort inside the nose, nose blocks. They can be bloody or blackish discharge coming out of the nose. They can be swelling in and around the face. Finally, when it enters the eyes and the orbit, they can present with double vision. When it's too much and when it's progressing, the eyes becomes really swollen. It can be protruding outside, and then finally they can lose vision. From one side, it can also spread to the other side. And the worst situation and the worst scenario is that it can extend into the brain, because eye and brain is closely associated. So these are the symptoms that we have to be extremely cautious about. And when are they presenting? We have seen that after they recover from the COVID, after 2 weeks, after 14 to 17 days, 14 to 20 days, patient present with these symptoms. So you have to be extremely careful about it. Is it a new disease? No, mucormycosis is not a new disease. It has always been there. Well, it was a rare disease. But now with COVID-19, we see a surge in the fungal infection mucormycosis. How does it happen? Whenever there is weakening of the body's immune system, these fungus grows inside your body. And how is it associated with COVID-19? So COVID-19 overall reduces the immune system of your body. There are many things that has been answered regarding mucormycosis and COVID-19, and there are many things that are still not answered. Most importantly, it affects those patients who are immunocompromised, immunosuppressed, especially those with diabetes mellitus, those who have undergone organ transplant, cancer patients, and in any condition where there is a weak immune system of the body. So I would say with the rise in the number of mucormycosis cases, it's very important to take precaution and prevent the infection. Prevention is always better than cure. And also to identify the disease at the earliest in order to save the vision, the eyes and the life. So there are certain things that we have to be cautious about, especially in those patients with diabetes. The diabetic control should be very, very strict, irrespective of the fact what medications that they are getting. Even in non-diabetic patients, it can be an undiagnosed diabetic patient, where you call them as non-diabetic. So the use of certain medications which are immunosuppressives, including steroids and other immunomodulatory drugs, have to be used with caution. And even if you're using it, you have to have a strict monitoring of the blood sugar, and it has to be kept under control. As a precaution and prevention, any patient who has been infected with COVID-19 and you've gone home after discharge, it's still very important to monitor your blood sugar. It has to be monitored every day. Look out for symptoms like one-sided headache, pain in the eye, nasal block, nasal discharge, even a loose tooth and pain and swelling in and around the eyes have to be looked for, and seek immediate medical attention, immediate attention of a specialist, even with the slightest of the doubt. And these are the things that you have to be careful about. As far as the treatment is concerned, in these patients who are infected with mucormycosis, it's a team of specialists who get together in the management of the patient. First and foremost, and most importantly, is the antifungal medications. We give intravenous or injections of antifungal medications like amphotericin B, and then also oral medications and tablets of antifungals. There are strong indications of surgical removal of the bad tissue and the fungal balls which may be present in the infected areas. So that's when an ENT surgeon, an oculoplastic surgeon like me, a maxillofacial surgeon and a neurosurgeon has a role. Ultimately, the aim of the management of these patients is to clear the disease as much as possible with injection and with surgery. At the end, I would like to highlight, if you were infected with COVID-19, you had diabetes, and if you have received steroids, you have to be extremely cautious about mucormycosis. Don't be scared about it. Your job is to strictly monitor your blood sugar level every day at home. Make sure your blood sugar is under control, strictly under control. If there is a little bit of high and low, consult your physician immediately. Look out for the symptoms that we discussed earlier. Any slightest of suspicion of anything which is going abnormal in and around the face, consult a specialist. And I would like to say that prevention is always better than cure, and take care of yourself. It is not too scary. If it is detected early, we can take care of it. Thank you very much.